Consider lifestyle changes such as limiting alcohol, caffeine, and nicotine. Some experts have suggested, though, that a glass of wine or beer may increase your appetite, but I also recommend that you check with your doctor first in case the alcohol may interfere with your medications and treatment. If you have not been placed on a special diet as part of your treatment plan, experts recommend eating low-fat, high-carbohydrate diets the day before your chemotherapy treatment. During chemotherapy treatments, it's recommended to avoid eating your favorite foods within 24 hours of the treatment to avoid negative associations with them at a later date. Eating a low-fat, less than 3 tablespoons or 40 grams of fat or oil per day, and consider high carbohydrates from grains, fruits, and vegetables, as well as ensuring that protein is added. After chemotherapy treatments, some small, frequent meals may be easier to digest, and things like fish, chicken, rice, baked potatoes, bananas, applesauce, as well as soups, bouillons, grape juice, and toast may help. Ginger ale may actually help stimulate your appetite. If your weight drops, maybe even things like adding smoothies or a meal replacement can help. Some people find that they need to avoid lactose, that's dairy products, as they can sometimes increase abdominal cramping. Some people have also found using boiled milk easier to tolerate. Treat other symptoms such as pain and fatigue, which if left untreated can increase your experience of nausea. Consider keeping a self-care diary and record frequency and severity of your nausea in response to your treatments. And the simple rule of thumb is trying to maintain a steady body weight throughout your treatment as much as possible. There's been some suggestions on some of the common chemotherapy drugs that we use, in particular carboplatin and cisplatin. It's been suggested to avoid purine-rich foods such as liver, caviar, sardines, and anchovies. Try to eat plenty of magnesium-type foods, although recognizing that when your magnesium drops, you often need the supplement. But these rich foods are green leafy vegetables, nuts, seafood, if not contraindicated. Eat potassium-rich foods such as bananas, oranges, prune juice, tomatoes, raisins, avocados, apricots, dates, kiwi fruit, and melons. Foods that are rich in zinc include beef, yogurt, oatmeal, baked potatoes, salmon, and chicken. And it's also recommended that you need to drink lots of fluids. With Taxol, you need to actually drink a lot of fluids with this one. And doxorubicin, you need to drink extra fluids and think about eating foods rich in B vitamins, particularly the riboflavin, such as milk, lean meats, egg yolks, and wheat germ. Etoposide or VP16, you may want to consider bland foods, and avocado again. And it's an excellent source of calories, essential fatty acids, has potassium and glutathione, which is an antioxidant. When it comes to managing constipation, you need to try to drink 3 liters of fluid a day and consider drinking hot liquids upon awakening. Modify your diet if permitted and as tolerated to try to increase some high fiber foods and roughage with fresh fruits, prunes, vegetables, whole grains, and dried beans to up to 20 to 35 grams of fiber a day. And if you're not already eating items high in fiber, consider even eating celery, bran, and whole wheat breads. If tolerated, some people find eating popcorn helpful, but I've had many patients inform me that popcorn is a trigger food that causes increased abdominal cramping and pain. Recognizing that some patients are experiencing bowel obstructions and may be on a specialized low-fiber diet, and we have phased diets here, and you need to have a lot of consultations with dietitians. Considering limiting the use of gas-producing foods such as melons, cabbage, incompletely cooked beans, green peppers, and onions, especially when you're trying to add them to your meals and cooking. Beano is a product that's been shown some usefulness in decreasing gas associated with these certain foods. Maintain or increase your physical activity as tolerated. Try to establish a daily bowel program, as Dr. Ella had mentioned, and consider taking the stool softeners for a day or two even prior to chemotherapy treatments, particularly because of the ondansetron being so constipating. And try to follow the schedule as prescribed by your team. When it comes to diarrhea management, I think assessment is really quite key. It's important to remember if there's any significant changes in your actual condition. And diarrhea is a common complaint with people who are lactose intolerant. In today's healthcare environment, we have to also consider the potential of excess diarrhea to be a result of an intestinal bacteria such as C. difficile or due to a virus. And could this diarrhea be related to an infection, especially during a period of neutropenia or when your white blood cell counts are down? It's important to consider such a concerning health problem if a fever is accompanied with the diarrhea. If you're experiencing significant diarrhea, monitor the level of weakness and fatigue and ensure that your safety is important. Consider using a walking device to help getting around safely and increase your independence. You may consider weighing yourself on a daily basis to ensure that you're not losing too much water and weight. And things like considering, is your urine concentrated or low in volume? Is your mouth dry? Those are signs that maybe you are getting dehydrated. If diarrhea is impacting your social situations activities, it's quite concerning. So you think about contacting your physician or team to see if there's some alternatives in managing it. If you're suffering from it, you may want to include, or you should be including, cleansing your perineal or anal area with mild soap, rinsing thoroughly, and patting the area dry, and consider even applying a skin barrier after each bowel movement. We know that chemotherapy can cause this increased cellular destruction on the bowel lining and can increase intestinal motility. So we know that medications such as antacids and antibiotics can cause diarrhea as well. So some foods that contain natural laxative products are fruit juices, coffee, alcohol, dried foods or fatty foods, or even if you suddenly decide to increase your fiber and changes in your usual dietary habits. So increased stress and anxiety in the presence of not being coping well with your treatments and your care can precipitate diarrhea as well. So things like modifying that dietary plan to avoid the foods that are not tolerated, consider smaller meals eaten more frequently. Consider restricting your diet to clear, warm, or even cool fluids such as bouillon, flat ginger ale, weak tepid tea, or apple juice for the day. And if diarrhea persists, check with your healthcare team. Avoid drinking meals, but drink plenty of water in between. Serve food and liquids at room temperature. Try to avoid coffee and alcohol. Avoid the spicy, fried, fatty foods. Consider relaxation, distraction. Low residue diets, decreased fiber and roughage, such as avoiding the whole wheat breads or high fiber cereals, raw fruits and vegetables, except you may be able to tolerate bananas and some soft cooked vegetables. Avoid seeds or skin on vegetables and fruits, dried beans and nuts, and avoid the popcorn and cucumbers and lettuce, as these food items can also be difficult to digest. The low lactose diet has been known to be a temporary experience during treatments. Consider maintaining your diet for several days after the diarrhea subsides and reintroduce dairy products slowly. Record the number and consistency of the daily bowel movements and report this information back to your team. Follow prescribed medication as scheduled. If problems persist beyond the 1 or 2 days, consider re-notifying your team. And bulk forming strategies can be used for both constipation and diarrhea management, such as Citracel or Facilium or Metamucil. And a newer products that are out is Benefiber, which is a fiber supplement that completely dissolves with stirring. It's not gritty and it has no taste. I actually add it to my tea, and I do not even realize that there's anything even been added to my drink. It's a great way to add fiber to your diet. It sits on my desk at work, on my kitchen table at home, and just sprinkle some on, stir it in, and you do not even realize you're having it. It also can be added to your favorite recipes, so consider using it when cooking. So I hope that I've shed some light on the understanding of the importance of being part of the team and management strategies related to your bowel care and chemotherapy. And I'm happy to receive comments and questions. Thank you.